This is a tricky disease. I mean, it's a silent killer of most of them may not have any symptoms. Don't assume that you are too young to develop hypertension. It is a disease of the youngsters also. Sleep pattern, his food habit, exercise and all.
So very warm welcome to all the lovely viewers. Okay, so doctor, when it comes to about blood pressure or hypertension, it must be a after 50s problem, isn't it? So why earlier people are facing it right now, like in early 20s or somewhere in early 30s as well?
We will be talking on hypertension in young adult. All the listeners here and the youngsters who are listening to this method, it is not for us, it is for the elderly people. So previously it was the disease of the elderly, and because say those days when I am starting my career some 30-40 years back, I used to see people above the age of 50-60s with hypertension, and during those days I may not even look at the BP of a person with 25 to 30 years because I never thought they will be having it. And that was true also at that times. And nowadays, the scenario has changed a lot. Now I am seeing all my patients, even 25, 30, they will be seeing me only after taking the BP because it is a disease of the youngsters also.
But doctor, I do have a question. What if someone looks healthy, goes to the gym and looks Instagram ready as well? Is there any possibility that this person could have blood pressure?
Recently, I have a patient who is doing his PG in one of the school, and he came with me slim fit like anything. He happened to visit a nearby general practitioner and found to have hypertension. Then he was said, "Is it correct, doctor?" He is saying that I am having 150, 100 and like that. Oh yeah, let me check and see. I said, you sit here and took his BP. It is 150, 100, no doubt. Both arms, it is 150, 100 only. Then I asked him, what are your lifestyles? Then he narrated each and everything about his sleep pattern, his food habit, exercise and all. Only that exercise is okay. All the rest is against this. So I told him, so you change over your habit, change everything. And about the gymnasium, I told weightlifting won't help you in any way for hypertension. So I told him, you change that habit. See, you can go for a running for half an hour, a modest speed running, half an hour, and you change your food habit, all those things. He agreed to me, did it well. After 3 months, when he come, the BP is 138. So rapid it has changed. So that can happen when we insist on the people with the diet and exercise.
Okay, so doctor, is there any kind of signals or symptoms which our body gives us in a warning sign?
So this is a tricky disease. I mean, it's a silent killer of people. Most of them may not have any symptoms to present. So if you diagnose hypertension, he will say, I don't have any symptoms. Like that he will say. But there are few people who will have symptoms like headache, morning headache. There are most of them nuchal headache, that they can have nuchal headache. Some people have fatigue. Some people have, apart from fatigueness, they have a nose bleeding, tricky, small type of nasal bleeding. They can have. And some people, for simple reason, they shout, they will be so type A personality, etc. Those people are hypertension. This is how we can diagnose these people. And by the age of 25, we have to start seeing the BP of every people coming to us. And those who are working also, those who are stressed, those who are obese, the family history, you have to start looking at the BP at 25 years. And if it is normotensive, then after 6 months, you can do the checking. Like that, you can go on. And if he is hypertensive, every month you have to tell him to review the case.
Now comes the stress. I think so. This is the biggest villain, isn't it?
That's a very good question. So nowadays, all these people are, whatever be the age, they'll be using mobile and seeing all the social media talk, everything. And people, if they may go up to 2 o'clock, 3 o'clock on using mobile. The light of the mobile, it will produce changes in the eye as well as in the brain. You have all the comparison between people, and that will also give stress to the patient who is seeing these videos and all those things every night. So better have a lifestyle modification like that. See, you better switch off your mobile at least 1 hour prior to going to bed. So that will help in not using the mobile during the night hours and reduce the sleep, and which can also lead to development of hypertension. So these things also count a lot in the production of hypertension in young people.
So, doctor, do you have any real life story our listeners can relate to, which can be shared over here?
See, just like all the things, I will give you an example of one patient who came to me. He was working in Bangalore in the IT field, and he is actually a son of my patient, cardiac patient. And he came along with his father. And after examining the father, his father asked me to see his BP. He is worried about the hypertension like that. When I saw him, his BP was 160 or 96. I told him that you are hypertensive. And then I asked him what about the lifestyle and all those things. So he is working more than 16 hours a day, sleeping less than 4 hours, and he is taking all the food from this all the KFC, like hotels, no homemade foods, and it's all salty foods only, no exercise for him. So I thought you better change your lifestyle. I advised him all the what all things have to be done for him, and he told me that he will certainly do it for me. And I thought he will not be doing like that. So after some 3 months, he came back. So showing that he is active, and he has promised. He did all the things I have told him. So now his BP is 140 over 84. So that is a dramatic improvement in him. I told him to continue your lifestyle and to come out 3 months. And after 3 months, it is 130, 80. I was happy to see him. I told him, no drugs is required for you, but you have accepted my advice. So that's why your BP has come down naturally. You continue like this. So he was very happy. So we can, in the early period, we can treat the patient without any medication. And if they are not responding to this lifestyle medication, you have to put the patient on drugs. They have to continue with lifestyle, or if he is accepting the lifestyle modification also along with medication, sometimes we can stop the medication also.
So now here comes the next question. There must be people who must be saying that I don't have oily stuff or oily food allowed, so I am on the safer side. How true is it?
Why this transition happens? It is because of the changes in the food habit, changes in the lifestyles. See, olden days, all these people will be working hard, and there will not be much of the vehicles here, and people have to walk from the school age, so they have to walk for 2 to 3 kilometers to reach the school and back to school also. And they will be playing a lot of games during the evening hours. But nowadays, not a single parent will insist for his child to do any games. Nowadays, make them study like that. So from that age onwards, the physical activity has reduced a lot, and this leads to obesity. So if you look into the schools, during our days, only 1 or 2 people will be having this hypertension and these obese people. Nowadays, nearly 20 to 30% of the students in one class will be obese compared to the normal weight. So this is just because of the diet they are taking and the lack of exercise. And youngsters, so adults also, they will be sleeping very less, up to 2 o'clock or 3 o'clock. They may not be sleeping, so they have a late night sleep, and all this leads to hypertension in young age.
So, doctor, before we wrap up, what would be that one message you want to give out to all the young adults who are listening to us now?
So, to these young people between 25 and 40, don't assume that you are too young to develop hypertension. So, what my advice is, check BP regularly, change your food habits, and protect your future. That's the final advice from me.
So yes, that's all for today. It was your anchor Sanyukta signing off. But till that time, keep watching us, stay healthy, walk often, sleep on time, and also make sure to keep a check on your pressure. For that time, thank you.